Hello, my name is Jamie Turner, and I am doing my topic on mental health issues around the world. I picked this topic as I currently work in a residential treatment facility for at-risk youth who each have a mental health diagnosis. I have seen children, teenagers, and their own family members struggle in finding resources to get the provided care they need. I also picked this topic as I wanted to do a research in seeing if this is just a trend I see locally or a trend that occurs in the United States and globally. I will be discussing stigmas in mental health, myths, and providing some statistics on mental health. I will also be sharing the struggles of resources and how to overcome those stigmas. What is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Over the course of your life, if you experience mental health problems, your thinking, mood, and behavior could be affected. Many factors contribute to mental health problems, including biological factors, life experiences such as trauma or abuse, family history of mental health problems. Some warning signs of mental health include, but are not all the warning signs, eating or sleeping too much or too little, pulling away from people and usual activities, having low or no energy, feeling numb or like nothing matters, having unexplained aches and pains, feeling helpless or hopeless, smoking, drinking, or using drugs more than usual. What are global statistics on mental health? Mental health disorders account for several of the top causes of disability in established market economies worldwide and include major depression, also called clinical depression, manic depression or bipolar disorder, schizophrenia, and obsessive compulsive disorder. Depression is the leading cause of disability worldwide. In the United States, in 2019, just prior to the COVID-19 pandemic, 19.86% of adults experienced a mental illness equivalent to nearly 50 million Americans. Over half of adults with a mental illness do not receive treatment, totaling over 27 million adults in the U.S. who are going untreated. Suicidal ideation continues to increase among adults in the U.S. 4.58% of adults report having serious thoughts of suicide. Over 2.5 million youth in the U.S. have severe depression. In China, the World Health Organization estimates 54 million people in China suffer from depression and about 41 million suffer from anxiety disorder. China has a highly regulated and centralized healthcare system, but mental health services make up only 2.35% of the total health budget. Of individuals with a diagnosis of a mental disorder, 91.8% never seek professional help. Besides stigma, there's an issue of access. Depression and anxiety are the two most prevalent mental health disorders in China. Mental disorders in Europe and mental illness are one of the most significant public health challenges in the WHO European region. The estimated prevalence of mental disorder in the WHO European region in 2015 was 110 million, equivalent to 12% of the entire population at any one time. 43.3 million suffer depression and 37.3 million with anxiety. There are many struggles to finding resources for those who suffer mental illness. In Europe, the combined number of psychiatric beds in all types of inpatient facility, mental hospitals, psychiatric units, and general hospitals, forensic inpatient units, community residential mental health facilities, and mental health inpatient services, specifically for children and adolescents, is 93 beds per 100,000 population. In China, there is insufficient mental health resources and service capacity, 1, due to financial investment, 2, hospital beds, the number of psychiatric beds, and the 3, professionals in China. For every 100,000 population, there are 2.19 psychiatric physicians, including assistant practitioners, and 5.51 registered nurses, whereas in high-income countries, there are 13 psychiatrists and 23 registered nurses per 100,000 people. At the same time, China is facing problems such as having difficulties in bringing mental health field talents and lacking rehabilitation technicians. In the United States, there are about 55% of psychiatrists who are not accepting new patients and 56% who do not accept their insurance. A third respondent, about 33%, reported difficulty finding any mental health prescribers who would accept their insurance either in or out of network. What are stigmas around mental health? Stigma refers to societal disapproval, or when society places shame on people who live with a mental illness or seek help for emotional distress, such as anxiety, depression, bipolar disorder, or PTSD. The pressure of mental health stigmas can come from family, friends, coworkers, and society on a broader level. It can prevent people living with mental illness from getting help, fitting into society, and leading happy and comfortable lives. The harmful effects of stigma can include feelings of shame, hopelessness, and isolation, reluctance to ask for help or to get treatment, lack of understanding by family, friends, or others, fewer opportunities for employment or social interaction, bullying, physical violence or harassment, and self-doubt. The belief that you will never overcome your illness or be able to achieve what you want to in life. There are a lot of myths surrounding mental health. One of the myths are that mental health problems don't affect me. Mental health problems are actually very common. Suicide is the 10th leading cause of death in the United States. It accounts for the loss of more than 41,000 Americans' lives each year, more than double the number of lives lost to homicide. Another myth are that children don't experience mental health problems. Even very young children may show early warning signs of mental health concerns. These mental health problems are often clinically diagnosable and can be a product of the interaction of biological, psychological, and social factors. Half of the mental health disorders show first signs before a person turns 14 years old, and 3/4 of mental health disorders begin before age 24. Another myth are that people with mental health needs, even those who are managing their mental illness, cannot tolerate the stress of holding down a job. People with mental health problems are just as productive as other employees. Employers who hire people with mental health problems report good attendance and punctuality, as well as motivation, good work, and job tenure on par with a greater than other employees. When employees with mental health problems receive effective treatment, it can result in lower total medical cost, increased productivity, lower absenteeism, decreased disability cost. The last myth that I want to share is that personality weakness or character flaws cause mental health problems. People with mental health problems can snap out of it if they try hard enough, when in fact, mental health problems have nothing to do with being lazy or weak, and many people need help to get better. Each country is doing their part in making mental health an awareness and overcoming stigma. In China, all levels of government and non-governmental organizations have been taking steps to improve mental health care in China, given how much of the population reports experiencing mild to severe psychological distress. Local governments have set up mental health support and suicide hotlines. Currently, the Substance Abuse and Mental Health Service Administration National Helpline is available 24 hours a day to provide free and confidential information on mental health services and treatment. The UN adopted Sustainable Development Goals recognizing the promotion of mental health and well-being and the prevention and treatment of substance abuse as global health priorities. The UN also created Transforming Our World, the 2030 Agenda for Sustainable Development. It is to seek to end poverty and hunger, realize the human rights of all, and achieve gender equality and the empowerment of women and girls, and ensure the lasting protection of the planet and its natural resources. To overcome stigma on mental health, you should talk openly about mental health, such as sharing on social media. Educate yourself and others. Respond to misperceptions of negative comments by sharing facts and experiences. Be conscious of language. Remind people that words matter. Encourage equality between physical and mental illness. Draw comparisons to how they would treat someone with cancer or diabetes. Show compassion for those with mental illness. Be honest about treatment. Normalize mental health treatment just like other health treatment. Let the media know when they are using stigmatizing language, presenting stories on mental health illness in a stigmatizing way, and choose empowerment over shame. I hope you enjoyed my presentation on mental health issues. If you are in a crisis, please seek help immediately. Call 1-800-273-TALK, 1-800-273-8255 to reach a 24-hour crisis center available through the National Suicide Prevention Lifeline. Text MHA to 741-741 to connect with a trained crisis counselor from Crisis Text Line. Call 911 or go to the nearest emergency room. If you are in need of support but not in a crisis, consider reaching out to your primary care doctor.